Hey everybody, it's Larly.
Hey Larly.
And Dr. Carnegie.
Hello.
Alrighty, do we have everyone on the air? Let's see, we have Mayor Freeman, Holly, Justin, Nathan. Right, we're waiting for Dr. Office Bonnie, and that would be it. And I talked to Mayor Friedman, pardon me, earlier today, and just because of the amount of people, I'm probably not going to stay on. I think people who aren't on the panelists or the host or have to be on for the fact that that's how you keep the stream going. I would say just as less people as possible, so that way it's not a crowded screen. But whatever anyone feels comfortable doing is also fine.
That's fine. I can jump off. Just wanted to jump on and make sure everything was fine here.
Right. I feel you. Same here. All right. It looks like Dr. Bafubani is on. Hi, Dr. Bafubani. Right.
Looks like he is still connecting to audio. Once he's connected, I will jump off and I'll watch from the Facebook live stream.
Awesome. And Janie, you on?
Janie's just hiding in the background, she said.
Yeah, I'm the little, I'm a city seal. I keep my camera off.
I think that's City Seal's perfect. Okay. Alrighty.
And Holly, just so you all know, my understanding is when you're watching on Facebook Live, there is a delay. I'm not sure exactly how long, but maybe 5 minutes or so. Does that sound right? I just know from our city council meetings, there's a delay.
Okay,
So
that's fine.
If you jump back in, it may be disjointed.
It's okay. I'm usually disjointed. It's totally fine.
Glad to hear your voice nevertheless.
All right. Well, I'm going to jump off and leave the Carillion work to Dr. Bafubani, and I will log on to the Facebook stream.
Well, I'm going to do the same. Let's just make sure. Dr. Bafubani, have you been able to join us yet?
Yes, I'll be live very soon in terms of video.
Oh, great.
Can you hear me okay?
No worries. All righty. All right. Well, Mayor Freeman, you have the questions. Everyone's been sent the updated questions with the added question. And if anyone has any needs, please give me a text. I'll be watching on Facebook. But I think you all will do fantastic. We have a fantastic panel here today.
Great. It's the appointed hour of 6:30, so I guess it is showtime. Welcome, one and all. Welcome to this first that I'm aware of, community town hall, certainly the first on the topic of COVID. As you all know, our community is deeply rooted in education, and our ambition this evening is to provide an education by addressing questions related to COVID, vaccinations, and best practices for how to deal with this pandemic. We want to be the antidote to myths and discouragement. In the few minutes we have this evening, we hope to equip all of our friends and neighbors with timely information from the professionals with the best and most current information. Allow me to introduce the professionals who will address the questions this evening. First, we have Dr. Laura Cornegay. Dr. Cornegay is the Health Director for the Central Shenandoah Health District, or CSHD. The CSHD is one of 35 health districts that comprise the Virginia Department of Health and includes the counties of Rockingham, Augusta, Rockbridge, Highland, and Bath, and the cities of Harrisonburg, Stanton, Waynesboro, Lexington, and Buena Vista. She graduated from the University of Virginia Medical School and is a board-certified internist who practiced in the Navy, in academics, and in private practice for 25 years. She received a Master of Public Health in 2012 and began work as a district health director in 2015. Welcome, Dr. Cornegay. Next,
Thank you.
next in our panel is Dr. Anthony Bafubani. Dr. Bafubani graduated from the University of Ghana Medical School, and he works in Roanoke, Virginia, and specializes in infectious disease and internal medicine. Dr. Bafubani is the medical director of infection prevention and control for Carilion Clinic. Dr. Bafubani, welcome. I think you're muted there, Dr. Bafubani.
Thank you for having me. Thank you.
Absolutely. Now, are you in Roanoke or just have that pretty picture behind you?
I am currently in Roanoke. So greetings from Roanoke to Rushbridge.
Excellent. Well, I'm glad to see it's a pretty day in Roanoke as it is in Lexington. Next is Justin Slagle. Justin is the Community Outreach and Patient Engagement Manager with the Rockbridge Area Health Center. In the 4 years he has been with the health center, he has helped to promote and provide access to comprehensive, high quality and affordable health care, improving the health and well-being of our community. Thank you and welcome, Justin.
Hello, everybody.
And our next professional is Nathan Ramsey. Nathan Ramsey is the Fire Rescue Chief and Emergency Management Coordinator for Rockbridge County. Nathan has been integral in the planning and logistics of the Rockbridge County and Lexington COVID-19 vaccine clinics. And I, like many people, are deep appreciation for Nathan and the folks that have put together the clinic that was held out at the former Peebles department store. Still a little sore from Tuesday, but on the mend and coming along. So thank you, Nathan.
Thank you.
We'll dive head first into the questions that we have received. I think we're also receiving questions via chat, or I'm not exactly sure how, but any other questions that you may have as you're watching this, please let us know, because again, our ambition is to educate folks on the details. But our first question is for Dr. Bafubani. How do vaccines work in general, and why are they important to get?
Again, thank you. And I want to clarify, even though I'm in Roanoke, what is behind me is a picture.
Ah, very good.
Yeah. So vaccines, let's start off with, think of a concert, going to a concert, or think of going to a school play. Before you go for the school play, the people who are putting on the play would have gone through rehearsals. They're going to do some dress rehearsal, they'll do a rehearsal and maybe even do a dress rehearsal. And then you have the main event, which is the school play, and then everybody sort of enjoys themselves and then goes home. So the school play will not be well done, or it's going to be a mess if there are no rehearsals. That's the same with vaccination. What doctors and or scientists tend to do is they identify a type of organism or bacteria or whatever causes the infection. They take a tiny piece of it usually, or they take a portion of it, try and kill it, and then they inject it into the human body. And what the body does is it identifies what looks like the infection, but it's a killed virus, or it may be a portion of it, and so it's not really infectious. And it does that dress rehearsal. It tries to fight it off. And then the body gets the memory that I know this thing. So when you get the real disease, which can truly kill you, the body is already primed and takes care of it. And that's what we have done for eons of time, and been able to eradicate polio for those who are old enough to remember polio, or even measles for the most part in the US, in many parts of the world. The same thing for smallpox. So vaccines have been with us for a long time, and it's a great way of taking care of diseases.
Sorry, I muted myself. So we should all do our part in the rehearsal and preparing our bodies by getting a vaccine so that we can fight off and don't have negative results from COVID-19 or the flu or any other vaccinations that come along. Thank you for that. Thank you for that explanation. The next question, what COVID-19 vaccines are approved for use in the United States, and what are the differences between the vaccines? And I'll address this question to Dr. Cornegay.
Sure. So we currently have 3 vaccines that are approved for use in the United States. The first 2 are Pfizer and Moderna, and those are what are called messenger RNA vaccines. So they use a very small part of the genetic material of the spike proteins of the coronavirus. The coronavirus is named as such because it looks like a crown. It's round, has little spikes that come off of it. And as Dr. Bafobani said, that gets presented to the body. The immune system develops antibodies. And when you get exposed to coronavirus, those antibodies are there and available to fight off the infection. The other vaccine that's approved in the United States is a Johnson & Johnson vaccine. And that's what's called an adenovirus vector vaccine. And like Dr. Bafobani said, it doesn't have any active particles that could cause infection in it. It's a little more of a traditional type vaccine, and it's a 1-dose vaccine versus a 2-dose series with the Pfizer and Moderna. They're all 3 safe and effective, and what they do with great efficacy is they prevent the most devastating consequences of COVID, which would be hospitalizations, ICU stays, or death. So all 3 are great at preventing those severe consequences of COVID.
When you look at the Johnson & Johnson, is it a larger dose that is administered and a much bigger needle?
No, it's no bigger needles, same size needles, which is good news for those of us who may be a little phobic about needles. It just doesn't require a second dose, whereas the Pfizer and Moderna do. We have vaccines that that we use both in childhood and adulthood. Some of them only require 1 dose to be effective. The Pfizer and Moderna are one of those vaccines that require 2 doses to get up to that 94% efficacy against COVID-19.
Terrific. What updates are there for the administration of the Johnson & Johnson vaccine? And is the Johnson & Johnson vaccine safe? And are there any microchips or other things in these doses related to Johnson & Johnson or the others?
Sure, those are great questions. So Johnson & Johnson vaccine was recently put on pause because of concerns for a very rare side effect that occurred in women. They described 15 cases at about 8 million doses of rare blood clots associated with low platelet levels. Given those serious side effects, the FDA took a pause with Johnson & Johnson so that they could review all of those cases and determined, that the consequences were so rare that the benefits of the vaccine really outweighed those rare occurrences. The good thing about that, and I think what the recognition of those side effects points to, is the safety mechanisms that we have in place for monitoring ongoing safety of all of our COVID vaccines. The vaccine adverse event reporting system is a reporting system that allows clinicians to enter data about any kind of adverse events related to vaccine administration. And kind of what that pause pointed to is the fact that we have a really robust safety infrastructure for ongoing monitoring of these vaccines. But again, very rare, 15 cases out of 8 million vaccines. So resumption of Johnson & Johnson vaccination, has occurred. We have updated the emergency use authorization that now includes a warning about that very rare side effect. And the health department has developed a one-page educational piece so that folks can learn about that side effects and really make an informed decision about which vaccine is best for them. We're really lucky at this point to have 3 different safe and effective COVID vaccines available to everyone 16 and above. In terms of other questions that we often get, that we like to dispel myths about in terms of vaccines, one is that the messenger RNA vaccines do not change the genetic makeup. They don't even enter the area of the cell where our DNA is contained. So, that's one myth that we'd like to dispel. The other myth is that any of these vaccines contain any type of microchip or tracking mechanism. That's just not true, whatsoever. So hopefully we can dispel those myths, encourage people that these are safe and effective vaccines, and get people out to our vaccination clinics and increase uptake within the population.
Certainly the vaccinations are intended to minimize the exposure or the risk to our health associated with COVID-19. And what a great circumstance to have options between 3 different applications. So if you only want one needle stick, Johnson & Johnson may be the ticket. If the COVID-19 vaccines were developed so fast, how are they safe and are they FDA approved? Dr. Bafubani.
Thank you very much for that. Okay, I'm on. So a good question. And I will start off with how are medications and vaccines approved in the US and by FDA. Keep in mind, though, I would like to say a couple of things about the FDA. FDA is a very, very, very conservative group. And the reason I say that is, and I don't know whether any of you are aware of what we call thalidomide babies. Thalidomide was a medication that was, worked very well for pregnancy-induced vomiting. People who got pregnant would take it and they would not throw up. And so it was widely used. It came on the market, was widely used in Europe. The FDA, which is the same FDA you have now, decided they were going to keep an eye on it, watch for more studies to be done on it before they would approve it. They never approved it. And in Europe, we started seeing kids being born who had, limb deformities, and ultimately that medication was taken out. That is to say the FDA does a very good job at keeping the American public safe. That is their charge. So how are vaccines and medications approved? They go through lots of studies. The first group of studies you go through is something called phase 1, where you look to see if the vaccine is safe on just a small number of people, and if it does what it says it's going to do. In other words, produce enough antibodies so you can fight the infection later on. Then they do something called a phase 2 trial as well. And phase 2 trials, you have more people, maybe 1,000, 100 to thousands of people. And then you look to see whether, again, the vaccine is safe, plus whether it is doing what it says it's going to do. If it's going to fight this disease, you try and see if it's going to do that. Then you do another bigger trial like phase 3, we call it phase 3 trials. For the currently approved vaccines, the number of people they enrolled for their phase 3 trials were between 30,000 and 45,000 persons worldwide, and capturing different types of populations, large numbers of persons, actually way more than most of other studies that we have done in the past. these vaccines were developed during the pandemic. So unlike other vaccines, where maybe a measles vaccine, it takes many years to get that 10,000 number or 20,000 that you will use. With COVID, we are in the midst of a pandemic. And so they were able to enroll lots of people who were exposed or could be exposed to COVID. And that's why we are able to register a large number of people over a short period of time to define whether the vaccines work or not. Whilst they were looking to see if the vaccines work, they were also looking to see if they were safe. And so that was also being done. Was it safe? Was it effective? And at the end of the trials, and normally the trials don't end on the last day you bring in people, you actually wait about 3 months and then look to see if there's still safety and still efficacy. And with that, after waiting 3 months, they said, yes, it's 94% safe, as Dr. Carnegie said, for the mRNA vaccines, above 70 plus for the Pfizer, Moderna, and markedly safe in terms of preventing hospital admissions and deaths, even higher than the numbers I've mentioned. And they were not seeing any signals to be worried about in terms of safety. And so these were approved under emergency use authorization. Typically, if we were not in a pandemic, they would wait 6 months, keep an eye on things, and then approve. Because we're in a pandemic, usually if you're going to see a safety issue, you're going to see it in the first 2 weeks, 3 weeks. They waited 3 months. But if you were not in a pandemic, they would have waited 6 months, which is about now, to approve it. And so I expect actually that the Pfizer and Moderna will be going very soon for their full authorization, since it's been 6 months. And so the way the vaccines were approved were done in a very, 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 very rigorous fashion. And as Dr. Carnegie said earlier on, even after the approval, the EUA approval, we go back and say, wait a minute, we're still going to collect information in case there is any rare thing. Because as I said before, these vaccines were tested in 30,000 or 45,000 or 40,000 people. That's a large number. But then you go and then you give it to 20 million, 30 million, probably 100 million now, or even more if you look at worldwide. I will just say a little story here. When I was young, I thought I was the shortest guy in my class, which was a class of about 40 or 50 kids from my town, my hometown. Then I went to a big city with a huge class of about 1,000, in the class, in the school. And guess what? I saw other shorter people who were way shorter than me, people who were way taller than me. And it's the same with vaccines and people's reactions to medications. Sometimes you see very rare instances of interactions, and it doesn't mean the vaccines are unsafe. It just means that we have to keep an eye on it and make sure that it's not happening more often. And that is exactly what the vaccine adverse event system is doing. So they are very, very safe vaccines.
Excellent. And with that FDA approval, it should give everyone comfort to know that it's been fully vetted and is safe for folks to take. And certainly all of us are unique, that we see each and every day. From the standpoint of what side effects can one expect from the COVID-19 vaccine, and which side effects should anyone be concerned about? Dr. Cordigay.
Sure. You can probably separate the side effects into 3 different types. The first would be local side effects, where you may have pain or redness at the site of injection, and that's a common side effect. The second would be the more systemic side effects. People can often get fever, headache, muscle aches, chills, symptoms that somewhat mimic COVID infection, but they're not caused by the infection, probably caused by the immune response that the vaccine is eliciting. Those minor side effects usually go away in about 24 hours or so. And the last is allergic reactions or anaphylactic reactions that occur rarely. Again, these vaccines are safe and effective, and the vast majority of people do quite well. If they have side effects, they're usually fleeting and go away after about 24 hours. In terms of severe side effects that you'd want to seek medical attention for, most of the severe allergic type side effects occur quite close to the administration of the vaccine. And things that we would be concerned about would be, swelling in the throat, difficulty breathing, a hive type reaction, anything like that. We would be tending to the person medically, or you should seek medical attention if you've left the clinic. In terms of that rare side effect that we talked about with the Johnson & Johnson vaccine, the blood clots with the low platelet count, again, that occurred uniformly in women about ages 18 to 50, and usually within about a week or two of the receipt of the vaccine. And things that you would look out for would be severe headache, shortness of breath, easy bruising, swelling in your legs, or abdominal pain. Any of those symptoms that would, signal potentially one of those severe reactions, you should seek medical care for. But again, the anaphylactic or severe allergic reactions occur in about 2 to 5 per million people who get vaccine, and that the clotting issue was in about 15 per 8 million. So these are extremely rare side effects.
And when you look at the reactions, it could be an allergic reaction, as you mentioned. I have a colleague who is allergic to eggs, and one of the questions she had was whether or not the vaccination has egg components or exposure to it. So folks that do have severe allergies still should seek out a vaccination, but can inquire as to the makeup of it and learn a little bit more. Predominantly, I would anticipate with their primary care physician who's already aware of their allergies.
Yeah, most people who have food allergies, that shouldn't be any problem with the COVID-19 vaccines. The Pfizer and Moderna vaccines have polyethylene glycol as a component. So if people are allergic to that, they shouldn't receive those vaccines. That's a preparation that can be used for constipation or for colonoscopy preparations. Likewise, the Johnson & Johnson vaccine has a component of polysorbitol. If you have an allergy to that, you shouldn't receive that vaccine. If you've had a severe allergic reaction to any kind of injectable medication or any other vaccine, you shouldn't receive the COVID-19 vaccines, or you should talk with your allergist about risks and benefits of receiving it.
Absolutely. Thank you, Dr. Cornegay. Can the COVID-19 vaccine actually give me the virus or change my DNA? Dr. Bafabani.
I think Dr. Cornegay was quite, straight on that. No, it can't. No, not at all. None of these are live vaccines, and so they will not give you the COVID infection. Yes, you may feel after you've gotten the vaccine, especially for the mRNA, after the second vaccine, you may get some symptoms like COVID, like the fever, the chills, the body aches. Usually lasts just about a day and then it goes away. When I got my vaccine, I was kind of waiting for those symptoms. They came very quickly and went away. I was kind of disappointed I didn't have more symptoms. But it's a dress rehearsal really for if you truly get the infection this time, then your body takes care of it even before you get these symptoms in a more severe form. So that's not something to be worried about at all. Does it change your DNA? Again, Dr. Carnegie did mention, it doesn't even go near where your DNA is, normally in the cytosol area, and then it's sort of excreted. So no as well. And there's a lot of information about COVID vaccine on the CDC website. And those are places, as well as the local health department, VDH, those are places we want to encourage us to look at rather than TikTok and other places where, this sort of people, in fun ways try and say things that are not really true, and we don't want to believe those ones.
That's where some of the myths can take flight and cover a great deal of territory. Well, clearly, in the time of COVID and lockdown and masks and everything, it's a time when people may find themselves, for lack of better terminology, in the family way. And if you find yourself pregnant, can the COVID-19 vaccine cause infertility or affect a pregnancy? And should pregnant women get the COVID-19 vaccine? Dr. Cornegay.
Yeah, the CDC, Virginia Department of Health, and the American College of Gynecology all recommend that pregnant women receive the COVID-19 vaccine. COVID-19 can be more severe in pregnancy, so can have worse ramifications on the mom's life and the life of the fetus. So it is recommended in pregnancy. As with the entire population, we're monitoring closely for any side effects, especially side effects related to pregnancy. To date, over 94,000 pregnant women have received COVID-19 vaccine without a problem. The CDC has actually developed a specific COVID-19 pregnancy registry that pregnant women can register with just for an extra safety measure of monitoring. There's nothing in the way that any of these vaccines work to suggest that they would affect fertility. So no, these vaccines wouldn't have any long-term side effects on fertility.
Terrific. Nathan and Justin, don't worry, we're going to get around to asking you a few questions, and I'm sure this is educational for you, and as it is for me. Dr. Cornegay, could you talk a little bit about if a teenager can receive, and when will children be able to get the COVID-19 vaccine?
Yeah, the emergency use authorization for Pfizer vaccine is for teens 16 to 18. Moderna and Johnson & Johnson are currently only approved for ages 18 and above. We fully expect that Pfizer and Moderna will soon have emergency use authorization for the 12 to 15-year-old age group. That's the next age group that would be approved. Pfizer has already submitted paperwork to the FDA for that approval. So we're expecting that perhaps as early as mid-May, we may get approval for 12 to 15-year-olds with Pfizer, and probably shortly thereafter, Moderna would get approved as well. We've started efforts within the district in schools for 16 to 17-year-olds. And I think that will be great in preparation for our coming fall semester. That'll get the rising seniors taken care of, and the seniors who will either be entering the workplace or going to colleges or universities will also be protected. And we're hopeful that we can start on that 12 to 15-year-old age group during the summertime as well. one thing to note for parents is that, kids in that age range often have vaccines that they need to get to go to the next grade. And with COVID-19 vaccines, the current recommendation is to separate those vaccines by at least 14 days from other vaccines. So you can't, go to the pediatrician and sort of get multiple vaccines, stacked on top of the COVID-19 vaccine. So just kind of keeping that in mind for, planning for the upcoming fall school year.
Terrific, thank you. There are lots of people out there like myself that tested positive for COVID. If you've already had it, as I have, do I need to get the vaccine? And when can I get the vaccine if I've had COVID-19? Dr. Bafubani.
Very good question. And that question keeps coming up a lot. So currently the CDC recommendation is that if you have COVID, let's say you have COVID now, you certainly want to wait till you are no more infectious to the person who is going to give you the vaccine. And then after that, you can get the vaccine and get your regular number of shots. Mm-hmm. Now, why is that the case? And the reason is, as we are seeing new variants in the community, we know that the vaccines actually work against the new variants as well. And so we do strongly recommend that even if you've had COVID, so far as you are not infectious, you wait the 10 days period that you're not infectious, and then if you're feeling great, just go ahead and get the vaccine.
Terrific. Dr. Cornegay, do you think that there will be a need to get booster shots related to COVID-19 vaccine? And if so, how do the booster shots work?
Sure. At this point, it's unclear whether we'll need booster shots or not. For some vaccines, you do need booster shots. For others, you maintain longer term immunity. We just need to have a longer time period to study the effects of the current vaccines to be able to make those recommendations. Basically, the way the booster shot works is it just sort of wakes up those memory cells that remember that they've been exposed to part of the virus or the bacteria. It kind of wakes them up, reinvigorates them, and allows the body to develop that robust immune response if you do get exposed to the disease. It's really unclear why some vaccines require boosters and other vaccines provide lifelong immunity. So we'll kind of wait and see, and hopefully have some recommendations in the coming months about what we need to do with COVID-19 vaccines.
Amazing the things that go on inside our bodies, but I can tell you as the father of a teenager, the booster would be really helpful with the teenage child. Spark them and get them reacquainted and off on their way. How effective are the COVID-19 vaccines against the new variants, and how are the new variants impacting our community? Dr. Cornegay.
The COVID-19 vaccines seem to be effective against the variants, which is great news. We watch variants closely. Virginia Department of Health has a genetic sequencing program that is able to detect variants that are circulating around the state. Statewide, we have identified some of the common variants, including the UK variant. Some of these variants are much more contagious than the previous variations on COVID-19. One of the things that viruses are very good at doing is if they continue to circulate within the population, they mutate, and that was to be expected. So really what we want to do is get the population vaccinated and get to a point where we have good herd immunity, have about 75 or 80% of our total population vaccinated. And that basically eliminates against susceptible hosts. If the virus can find someone to infect and somebody to, spread the virus onto, it basically will burn itself out. So we're hopeful that our vaccine campaign can kind of outrun the virus mutations.
Terrific. Thank you very much. Now, Dr. Bafabani, you've folks that are out there listening and have decided, okay, I'm moving forward with this. I've decided I don't want the Johnson & Johnson. I'm going to lean towards the Pfizer and Moderna. In that instance, how much time do I need to wait before I receive my first dose and my second dose?
Just keep two numbers in mind, 21, 28. 21, 28. Pfizer, 21 days, and then Moderna, 28 days. Keep it simple.
Excellent, thank you. Dr. Cornegay, what happens if I get the second dose of Moderna and Pfizer after the recommended time frame? Looking at 30 days or 35 days. Will I have to restart the whole process?
Yeah, the good news is you don't. The CDC actually has guidelines that you could get the second shot up to 42 days interval between the first. It's certainly recommended that you stick with that 21 and 28 day schedule as best you can, but all is not lost if you're not able to do that. So up to 42 days, it would be effective. You wouldn't need to restart. There's no guidelines, in fact, at this point to restart the series at any point, but it is important to get that second shot.
There's a fairly good sized window there to work within, or if you're someone who feels like they're not good with numbers or planning, Johnson & Johnson may be the vaccination for you.
Yes, that makes it incredibly simple.
Mm-hmm.
Terrific. If the first dose of the mRNA vaccines are close to 80% effective in preventing COVID, why do we need the second, Dr. Cornegay?
The second just clearly increases the number of antibodies that you have to fight off the infection. One of the vaccines after the first dose is probably about, 55 to 60% effective. The other about 80% effective. But with the second dose, you're getting up to near 94% efficacy. The CDC actually just put out data today that really speaks to the importance of that second dose. They looked at hospitalizations for the greater than 65-year-old population with COVID amongst people who had totally completed the series versus the partially immunized folks who had only gotten one of the vaccines. And they found that in people greater than age 65, there was about a 94% reduction in hospitalizations amongst folks who were fully vaccinated versus a 64% reduction in hospitalizations for those who are only partially vaccinated. So I think that's hard data that really supports the importance of that second vaccine.
Rather be safe than sorry, without a doubt.
Definitely.
Terrific. Now, we don't get to choose when we get sick or if we get cancer or some other disease. If we have a medical condition like cancer, should I get the COVID-19 vaccine, Dr. Bafabani?
Yes. Again, a very good question. The first thing, obviously, is you want to talk with your PCP and your cancer specialist. However, there is no real contraindication in those conditions to get the COVID vaccination at this point in time. So no, there's really no big contraindications. But again, for individuals, I would encourage you to talk with your provider and know the best time to get it.
Terrific. Thank you very much. I want to talk a little bit about vaccine access. It's out there. We hear it in the news every day, people talking about it. There are clinics. But at the end of the day, is the vaccine free? Do you need insurance, or how do you go about pursuing the vaccine after these compelling stories and education of why you should get it? Justin, can you address that, please?
Yeah, so I think it's a common barrier for people that, what does it cost? It's always the first question, and I'm very relieved to say that it is free to everyone, and you do not have to have health insurance to receive a COVID-19 vaccine.
Terrific, thank you. Right now, Dr. Cornegay, you talked a little bit about who can get a vaccination, everyone over age 16, and we've gone through the phase A1, I believe it was, or different criteria. But Nathan, can you address who currently can get vaccinated and where?
Yeah, sure. And like you'd mentioned, Dr. Cornegay covered that very well. But currently now anyone is 16 and older is available or able to get the vaccine. It's become very, very simplistic now. The clinics are running pretty much walk-ins. We prefer to have appointments scheduled and pre-registrations for none of the inventory control there of the vaccine, but anyone 16 and older can currently get the vaccine. And it's also here at our site, the regional site, the Old People's Building, Gordman's Building, that we've been at for the last couple of months. Starting on May 18th or May 18th, we do have scheduled a Pfizer and Moderna clinic going on at the same time. So should be able to cover that age group. And as Dr. Cornegay had mentioned, that hopefully in the near future we'll be able to do younger folks as well. But for now, 16 and older can get that.
You talk about making an appointment. I'm coming to you from my office at Cornerstone World headquarters in downtown Lexington. And a client I was meeting with earlier today said that she hadn't pursued. She is old enough to have received a vaccination, but she wasn't quite sure because she doesn't do a lot of things online. She likes to be old school. She said she actually has one of those odd boxes on the wall with a long string that you and I telephone.
Yeah. So essentially, there's it's very, very simple. There's a number you can call. It's a phone number. It's called 877 VAX in Virginia. That's to the call center there in Richmond with VDH. They can get you registered. Or essentially every Tuesday now, at least in the month of May, and some additional days, we'll have the clinic open. It typically opens at 8 o'clock in the morning. And like I say, anybody can walk up. We have a registration table there. Just tell the person at the door when they come in whether you have a appointment or not, that you would get asked if you have an appointment. And then if you don't, then you'll be directed to the proper place to get that registration take place. Otherwise, you'll be able to roll on in and get in line and be able to get the vaccine. So,
sure. But if they want to make an appointment, the 877 number, or even Dr. Cornegay, they can call the local health department, perhaps, and get some connectivity that way. If they,
yeah, no, you sure could. There will always be folks available locally to help get folks registered, to make them aware of opportunities, within the community. As Nathan said, even for walk-ins.
Terrific.
In addition to that, Mr. Mayor, is the couple of websites there specific to the health district is vaccineappointments.virginia.gov. And that is a very simplistic website. You can put in your zip code and it will direct you to the clinics that are close to your area, anywhere within our district, to be able to sign up, schedule your appointment. There's also abilities to do that at local pharmacies as well through vaccinefinder.org. And then our another regional partner of ours is Augusta Health that can, they're having clinics throughout the region as well. As a matter of fact, they have one today in the Natural Bridge, Glasgow area, but you can also sign up for their clinics through vaccinate.augustahealth.com. So plenty of ways to get the vaccine now. It's very, very simplistic. Just come on in. We encourage that.
Tuesdays during the month of May, come on down to the Old People's and the Tractor Supply shopping center there, and be glad to give you a shot. Terrific. Now, you all are great, fine, upstanding folks that work hard and do great things in our community, but there's some rogues out there who are trying to scam people. Justin, can you tell us a little bit about scammers and how we can prevent or avoid a vaccine scam?
Yeah, I would say the first thing would be to be cautious if you don't recognize the number. And especially when, as soon as they say we're trying to sell you the COVID-19 vaccine over the phone, that should be a first red flag right out of the gate. Just remember the vaccine is free and it's accessible in our area through many organizations. So there's no need to pay for it. And you do not want to give out personal information or financial information to anyone you don't know over the phone. If there's any doubt, reach out to a trusted source like the local health department or any of the community partners on the call here. They'd be happy to give you more information. Common tactics would be to play on someone's emotions or add a sense of urgency to needing your personal information or your financial information. And that's just a tactic to use to kind of create a stress that you have to do something. But sometimes it's easier just to take a step back, take a breather. You don't have to make any decisions right then. Similar tactics are used online as well. So if you're getting an email from a source you don't recognize, look at that URL, look at the domain. Sometimes there's little things that are off. Maybe it's .com and it's maybe the email says .con. So it's little things like that to just keep your eyes open. And again, do not click any links and emails that are not from trusted sources.
Absolutely. If something sounds too good to be true, pay to get your vaccination or move you up in the line, not accurate information. So
correct.
Now, Justin, you're with the Rockbridge Area Health Center. How are they focusing their vaccination outreach efforts? And how do you schedule an appointment at the health center if you're not going to go by people's store on Tuesdays?
It's a good question. So we've been vaccinating here at the main office in Lexington. We're located up by Spencer's across from Walmart. So we've been doing that for a while, but we're also collaborating with community partners to get out into the community for mobile clinics. So we've had 2 in the past month, one at the Maury River Senior Center, another one at the Rockbridge Area Relief Association. This upcoming month, May 19th, we will be hosting another clinic with VPAS in the city of Buena Vista there from 12 p.m. to 6 p.m. at the Maury River Senior Center. May 20th, we're going to be hosting a clinic at the First Baptist Church of Lexington. That's 2 p.m. to 6 p.m. Now, recipients of the vaccine must be 18 years or old. Walk-ins are welcome, but as Nathan alluded to earlier, it is best or recommended to pre-register for these. It's nice to know that you have an appointment or an appointment time so you're not waiting in line. And you can do so by going to our website. So that'll help you get registered for either of these upcoming clinics or just a vaccine here at the Rockbridge Area Health Center. Our website is rockahc.org. And on the website, right on the homepage, is a link to pre-register for any of those clinics. Once complete, patient access here at the health center would contact you and let you know of your appointment time. And also, if you don't have access to a computer or email or things like that, you can give us a call or text us at 540-464-8700, and we're happy to help you out and get scheduled.
Excellent. Thank you. Dr. Bafabani, can you talk a little bit about Carillion's focus and how to get connected with them as another option? You've muted yourself.
Sorry about that. Thank you very much. At Carillion, one of our beliefs is that we are in this together as a community. And so we've partnered with all the local areas as well as with VDH. And a lot of our vaccination efforts are, you reach out to VDH, they can point you to where we are having vaccination clinics. That is one way of doing that. We also have a phone number for Carillion Direct, which will also push you towards a place where you can get vaccination. The number is 800-422-8482. And then the VDH website has other links where you can also register. So by phone or by internet, different ways of vaccinating. And then we have partnered with the local PCPs as well, so that initially Carillion did work with VDH and has done a lot of the big events in the Peebles area, the Peebles building. And we're now moving towards doing more of mobile vaccination, and this time in going to areas beyond the Lexington area like Goshen. And so what we are doing there is we inform the PCPs that, hey, there's going to be a clinic here. And so our hope is, we know that lots of people listen to their primary care providers, especially when people are hesitant about getting the vaccine, when they know that their primary care provider is telling them it's a good thing to take, they are more likely to listen to it. When even if you don't have a primary care provider, but your grandma has a primary care provider or your mom has a primary care provider and is telling you it's probably a good thing to do, and we know that that's where we get that acceptance. So that's another area in which we are sending information, and then we are able to vaccinate when we go to these areas as well. So that's sort of the partnership we have, what we've done previously, and what's our next plans going forward.
Terrific. Thankful for the work that all of your organizations do within our community to help us to be safe and healthy. I've had the good fortune of most of my life being a very healthy person who doesn't get sick often, and frequently for years, I never got a flu shot or any other shot unless it was required. Do I need a COVID vaccine, COVID-19 vaccine, Dr. Cornegay, if I'm already young, healthy, and doing great?
Yeah, we recommend a COVID-19 vaccine for everyone. I think one of the challenges of COVID-19 infection has been that we really can't predict with any kind of certainty who's going to have a severe, outcome with COVID-19 infection. And by severe outcomes, we would include, hospitalization, ICU stays, and even death. So that's unpredictable. It can happen in folks with chronic disease. It can happen in older ages. It can also happen in young, healthy folks. So it's really important that everyone get a vaccine. I think taking a step back and thinking about a couple of goals of vaccination, the first goal is to protect your personal health. So the COVID-19 vaccine would do that for everyone. The second goal is really to protect the people around you. So even if you get the vaccine, you could potentially transmit asymptomatic disease to others. So in getting the vaccine, you're protecting, the more vulnerable folks around you. And the third reason to get vaccines is really to protect the population as a whole. As I stated, in order to kind of get beyond the global pandemic, we're really going to need 75 to 80% of large populations immunized, and getting your individual vaccine, you're really doing your part to contribute to that herd immunity. So I think there's, personal protection for the vulnerable folks around us, and then protection of our large communities as a whole.
Terrific. Now, Dr. Bafabani, I had my second Moderna this past Tuesday, so I'm 100% fully vaccinated, right? Or am I?
Good question. So we consider full vaccination or fully vaccinated 2 weeks after your second dose, if it is a 2-dose vaccine, or 2 weeks after the Johnson & Johnson vaccine, if it's a single-dose vaccine. So I would wait there 14 days, and then one would consider themselves fully vaccinated.
And then I'm free to run around without a mask, hug people, or am I?
Not really. And so as Dr. Carnegie mentioned, one thing the vaccine does for you, it does strongly protect you against having severe disease. And that's important to be aware of. However, you may contract the virus and unknowingly spread it. We're going to get more information about whether that truly happens or not, but we think that that's something we still want to be cautious about. Also, I think of the vaccine and the pandemic and vaccination in this way. Think of a huge thunderstorm, lots of rain, rainstorm, and think of the vaccination as an umbrella. So if there is a huge hailstorm, huge thunderstorm, having an umbrella, being that one person vaccinated, may not really protect you. You're going to go and the umbrella is going to be swept off. However, the more people get vaccinated, the thunderstorm or the rainstorm becomes an umbrella. And then all of a sudden you have a nice umbrella, just a little bit of a drizzle, and you're more free to do things. So vaccination protects us individually. And also the more we vaccinate, we actually change the environment such that we are able to do more stuff.
Excellent, excellent. Dr. Cornegay, can you speak to when we can travel once we're fully vaccinated?
Sure. The CDC has recently updated travel guidance for fully vaccinated people. So you can travel domestically, and previously they had suggested that you quarantine on return to your home state, and that you probably be tested. They removed those restrictions for folks who are fully vaccinated. So as long as you're asymptomatic and doing well, there's no reason to have to quarantine on return to home. So kind of opening up those travel possibilities. Likewise with international travel for fully vaccinated folks, they've removed the necessity to quarantine on return to home. It really also opens up, a lot of possibilities for visiting loved ones that you haven't seen. Grandparents who are totally vaccinated can visit with their unvaccinated grandchildren without a mask and without social distancing, and finally get that hug that they've been, waiting a year to receive. So there are a lot of things that you can do when you're fully vaccinated. The CDC yesterday put out guidance about masking, saying that fully vaccinated folks who are outdoors could forego the masks as long as they're not in large congregate crowds. So there's lots of benefits to vaccines, and we hope that people for no other reason consider getting a vaccine so that you can get those family hugs once again.
Excellent. We're all looking forward to those days when we can hug and spend time together, and family dinners. Miss those opportunities that we can do it safely, and once we get the vaccinations. I would hope that that would be enough to convince someone to get vaccinated. However, Dr. Bafobani, what can I say to my friends and family members who are vaccine hesitant to convince them to get vaccinated?
I think it's the right thing to do. And I'll say this, in the US, each generation at some point in time has been, has done something. Like our veterans have been to different wars, be it World War I, World War II, Vietnam War, Iraq. We ask young gentlemen, young men and women to go outside the country and go fight an enemy, face bullets. And that's a sacrifice for the freedoms of to continue with our freedoms. This generation's big ask is to get a little stab in your arm so you can see grandma safely and not put her in an ICU on a vent. This is so that kids can go back to school and learn and progress. This is so that businesses can open up and the people who operate the businesses do not end up in hospitals, because unfortunately with this disease, it's not like the flu or anything, which is the one to vaccines for, because it can also kill, but then this does a true number on us. So in my mind, this is a truly patriotic thing to do, knowing how well it performs and how safe these vaccines are. And that's what I would tell any person to do.
Amen. Good words and good perspective. The enemy is the virus, and anything we can do to defeat that enemy, the better off we'll all be in our community, and ensure our freedoms that we enjoy each and every day. Nathan, I'll call on you in just a second. You've been fully vaccinated. You're working in the healthcare industry. Why did you decide to get the vaccine?
Yeah, sure, Mr. Mayor. Aside from the protection of family and myself, for sure, to try to limit a hospitalization, but one to and also for public health, but for my position as emergency management coordinator and everything that we do, it is one to set the example, to show that the vaccine is safe. While there was a few side effects, like Dr. Buffabani mentioned, it was very brief for me as well. And my wife, she had hers as well. Her side effects were a little more severe, at least so she says, than what I did. But to protect and to try to get back to normal, and hope that we can very soon. So that was my reasoning behind that, to protect the public, family, and myself. And in closing too, if I could just mention, I would like to thank our wonderful partners that we've been working with for the past year. Led by Dr. Cornegay and her team. It's been a learning experience. I think we learn something every day, but also with our partners, with Carilion Clinic, Rockbridge Area Health Center. We created a task force early on with this group of folks, with the city of Lexington and Buena Vista and Rockbridge County, that we meet weekly, and sometimes more than once a week, and we work with each other very, very well, communicate well. So I would like to just express my appreciation for our great community that we have here.
Excellent reasons, and a big thank you for all the collaboration. Justin, what about you?
I don't know if I could say it any better than what's already been said. I mean, all these reasons factored in together, helping, personal safety, the safety of others, community. I can say it's a great feeling to feel part of the community and feel like I'm doing my part in helping others. It's just one of those things where I really encourage anybody watching to really take the facts and go for it. Personally speaking, I didn't have any side effects with either vaccine shot. So there's that. I was worried like most people about that, but yeah, everything worked out great, and I really encourage people to do that. And I'd also like to reiterate what Nathan said. A lot of great people, a lot of great coordination, especially in the community, emergency management, Central Shenandoah Health District, the health systems, everybody just pitching in together. The colleges, everybody's been working together, even back when we started testing, all the way through to the vaccine and moving forward. So just thank you for letting us be a part of the town hall, and look forward to working with you and continuing to work with you.
Well, I certainly hope that we don't wait for another pandemic to have our next town hall. And I think that each and every one of you have other responsibilities in addition to preparing and dealing with the response to COVID-19. Dr. Cornegay, when you took the health department job, I probably in chapter 57 of your manual, it said what to do in the case of a pandemic, but probably thought you'd never have to rely upon that. But it'll be a great day when we can have another town hall meeting in person and hopefully talk about something more progressive. But certainly right now, the clear message is a word of thanks to Laura Lee White and Holly Otsby, who put this town hall together, and Janie Hostetter with the City of Lexington, who's hosting our Zoom component and broadcasting on Facebook Live. And then certainly at the Peebles and all the other clinics, the volunteers, the professionals like yourselves, and the first responders. It's really heartwarming to see the fire and EMS uniformed folks administering the shots and working so hard to help our community as they do each and every day. It's the only circumstances under which I hope to see our first responders. I'm glad they're there and they do a great job, but a shot in the arm is a whole lot better than at an accident or something of that nature. But Dr. Bafubani, Dr. Cornegay, any closing remarks or observations?
I would just say, in answer to your last question, why did I get my vaccine? Is I read the literature. I looked at the studies that were done, and I concluded for myself that the studies were well done, and it was proven not just to be effective, but very safe. So I felt very comfortable receiving the vaccine, and I thought it was the right thing to do.
Fantastic. Dr. Cornegay?
Yeah, I would echo that. When I was in medical practice, I always tried to recommend things to my patients in the same way that I would recommend them to family members. Likewise, as a public health professional, my recommendations to the population as a whole are the same things that I recommend to family members. So my daughter, my husband, my in-laws, my parents have all gotten vaccinated, and I would encourage everyone to do the same.
And thank you to all of you for participating this evening. We've gone a touch over our 7:30 finish line, but a big thank you to your families because each and every one of you I know have sacrificed a lot of time and effort for the benefit of our community. But that will conclude our town hall, and we look forward to the next, and hope everyone has a great evening and happy May Day.
Thank you.
Thank you.
Thank you.